friends, as you know, high blood pressure is a very common medical disorder, which is approximately around 1/3 of the population in the country suffering from high blood pressure in the adult group. And to control the blood pressure, we know now that blood pressure more than 140/90 is not good, and we have to control it to 130/85. And for that, medications are essential, no doubt in that. But I feel that lifestyle modification should be a complementary for this. And for the lifestyle modification to control blood pressure, we have now evidence for various studies and trials which have shown us that if you in the diet, if you reduce the salt intake, if you're a habit of taking extra salt, reduce to 5 grams of sodium chloride per day, may be ideal for you, and so that we prevent adding extra table salt to the salad or on the curd or in the nimbu pani, and those extra salt, papad, achar, this type of the extra salts we should try to avoid. And at the same time in diet, if you can add potassium, that it reduces blood pressure by a few millimeters, 2 to 4 millimeters. So potassium diets which are rich in potassium are basically like the lemon water, citrus fruits, the natural nuts without adding salt in that, coconut water. These are the things which adds potassium to the all green vegetable, most of the fruits. So if you indulge on this group of diet, then there is an increase in potassium which reduces the blood pressure. So reducing salt and increasing potassium both helps in reducing the blood pressure in general public. Secondly, I will say regular exercise, the endurance exercise, even walk 10,000 steps per day may be good enough to reduce blood pressure by 2 to 4 millimeters. And we have learned now that not only it reduces blood pressure, also reduces the triglyceride, increases the HDL cholesterol, improves the sensitivity of sugar. Some multiple benefits of the exercise are well known to us. Now, besides that, if a person is obese and he's having a BMI high, we request them to reduce their blood pressure, body weight, and by reducing body weight itself, blood pressure comes down. And fourthly, if you are taking alcohol in excess, I mean more than 2 units or more than 60 ml per day of hard liquor or 150 ml of wine or 1 pint of beer, more than that, then there is an increase in blood pressure. So we request the people, those who are on habit of taking alcohol, to reduce the alcohol intake. And smoking is strict no-no. Any tobacco is strict no-no, because there is a lot of study which have shown smoking and tobacco taking, if you are consuming those type of tobacco products, there is an increase in the blood pressure also. The other important thing which you sometimes miss in the general public is snoring. The habit of snoring, people sometimes say, is a very common thing, is a normal thing, is a natural thing, which is not fact. In fact, snoring disorder, which we medically termed as obstructive sleep apnea, is one of the very important cause of secondary hypertension. So one should be very careful and get treated by doing the sleep study, and sometimes we may have to reduce the weight only, or we may have to add the CPAP machine in this group of population. The other area which I want to discuss with you is the drugs. Sometimes we use lot of painkillers, lot of steroids, other drugs. I mean, on the counter drugs are available like ginseng and all that. This group of drugs are also known to increase blood pressure. So we unnecessarily should not take those over the counter drugs like this, which will also increase the blood pressure. So in a nutshell, what my suggestion is that if you follow a lifestyle, then a significant reduction of blood pressure can come. But sometimes, in spite of all this thing, the blood pressure is not reached to the goal of 130/85, and then that medicine has to be taken. And if you have to take medicine, follow the instruction of the doctor. Thank you. So we come to the second part. Dear friends, as you know, for the management of hypertension, blood pressure lowering drugs are very important. And we have also learned now that if you have your doctor prescribe you a drug, if you increase the drug to double the dose, the blood pressure reduction is not that adequate. Now the guidelines and evidence has come from the studies which have shown that we should use 2 group of drugs of different mechanism of action into a single pill to improve the compliance, to improve the cost, affordability becomes better, it is more effective and has less side effect. So if you use 2 group of drug into single pill, the efficacy goes up by 5 times compared to doubling the dose of the same drug. So it improves the compliance. So what we say that the drug should be taken as prescribed by the doctor, and one should continue the drug. One should not feel that once we have started a drug, that means you have to take drug for lifelong. Yes, in majority of the patient, probably you may have to take lifelong. But in certain group of population, those who are obese, those who are indulging on excess alcohol, smoking, those who are not exercising, taking extra salt. These are the reversible, or those who are suffering from OSA. These were the reversible causes. If you correct the reversible causes, the significant reduction of blood pressure will come down, and the doses of the blood pressure medicine can come down. Or maybe in some rare cases of mild hypertension or stage 1 hypertension, we may discontinue. Other thing is which we should learn, particularly staying in northern part of the country, is the seasonal variation of the blood pressure. We have seen that in winter the blood pressure goes up because there is no sweating, no water loss, no salt loss, blood vessels constrict, we don't exercise, there is a pollution, there is a low vitamin D, we indulge in more alcohol, smoking and extra salt. So all these factors, they increase blood pressure. So every patient, particularly those who are staying in northern part of the country, should go to their doctor in the month of November, end of November, and escalate the doses of the blood pressure drug under the guidance of a doctor. Reverse is true in the month of May and June, when there is a sweating, there water loss, blood vessels dilate, people they exercise, the blood pressure starts going down, and we may have to de-escalate the doses of the blood pressure. But everything should be done under the guidance of doctor. So compliance of the very important. If you don't control your blood pressure, you're going to have heart attack, you're going to have heart failure, you're going to have stroke, you're going to damage your kidneys, you're going to damage your eyes. So be careful. Control your blood pressure. It is very easy with lifestyle modification and proper drugs under the guidance of doctor. So follow that, and don't leave your medicine on your own thinking that the blood pressure drug, because many people, they make a mistake that once they take the BP is controlled, they try with stopping the drug, and they keep on checking blood pressure for 2-3 days, and they found blood pressure is normal. That gives them a impulse, okay, my blood pressure is normal without drug, but they forget to check blood pressure after 6th or 7th day when the BP goes up. Because when we know that if a patient is on a blood pressure drug, even if you stop drug today, the effect of the drug in the body remains for 5 days. So this is a common mistake done by the patients, and ultimately they end up with lot of complications. So don't do that. It should be done under the guidance of physician. Don't stop the drug, continue the drug, and don't play with this type, or don't do this type of experiment, and follow instruction of doctor. He will guide you when to reduce the drug and when to stop the drug. Thank you very much.